Greetings, my name is Jed Shlackman, and for this video I'll be speaking about the subject of addictions and hypnosis, looking at how we could apply hypnotherapy in the process of treating addictions, helping people heal and recover from addictions. To begin, let's explore the idea of addictions and the role they play in people's lives. Addictions aren't something that exists in a vacuum per se, independent of other aspects of a person's life and psychology. So to treat addictions, it's not just a one-dimensional, one single type of focus. You often want to address multiple aspects of a person's life, multiple layers of their being. So it's not just a physical, biological phenomenon. It's not just an emotional phenomenon. It's not just a behavioral phenomenon. It's not just a spiritual phenomenon or a social phenomenon. It can involve elements of all of those. So if we're looking to work on healing and helping a person recover, we need to really be very individualized in a sense, looking at each person's life and what factors or elements are contributing to their addictive pattern or behavior. You can do something in a very limited sense, treating an addiction where you're in some way disrupting the particular association or attachment to that particular pattern or substance, whatever the specific addiction might be. So it could be alcohol, it could be some type of other drug, it could be gambling, it could be sex, it could be shopping. Whatever that addictive pattern is, we can do things on the surface level, in a sense, to block that particular behavior. So you could help someone lose their craving for a particular substance. So there are medications that are given to some people that are supposed to block their craving for a substance. You could put them in a different environment where they won't be around the temptation for a particular substance or particular behavior. So if someone is out living in the wilderness, they're not going to have access to cocaine or some drug. And let's say the addiction is gambling, well, they're maybe not able to go to a facility for gambling, or not able to go on the internet to a gambling site. But that's not really a permanent solution, because they may not be able to stay in that environment indefinitely. They have to get back into their regular life, integrated into everyday society, where they can't escape that those temptations exist out there. You can't completely separate yourself from the rest of your life, from the rest of the world. So we want to be able to look at some of the deeper levels of things to uncover what are the social, emotional, psychological, and spiritual factors that are fueling a person's inclination or desire to partake in a particular addictive pattern or behavior. So if we think about what are the functions or roles that an addiction plays, we can see that they often fill some role or void in a person's life, or they compensate for something in some way. Often an addiction is allowing a person to escape from things that are unpleasant or stressful in their life, or if a person feels some form of boredom or some lack of excitement or passion or satisfaction in their life. An addiction can give them kind of a stimulation, an adrenaline rush, something that gives them that feeling of excitement or energy that they've found to be missing in their life. And it's many different types of addictions that could fulfill that role. For some people it might be a substance, for others it might be some risk-taking behavior, for other people it could be accumulating material possessions. So there's lots of things you could be addicted or attached to that are serving a particular function or role in your life, in some way compensating for some imbalance, some place in your life where things aren't flowing or harmonious. So we look toward what are those deeper issues so we can address those. In many cases it relates to early life attachment issues or traumas, things that kind of set up a particular pattern in a person's life that fostered the way their personality developed. So if we look at that deeper level, we can often find what are kind of the core reasons why people develop addictions, which isn't just the particular substance or particular behavior or habit they encountered and picked up at a certain point in their life. It could be something that precedes that, something that created that void or space in their consciousness that the addiction has been filling in, has been taking up and consuming for them. So this brings us to the subject of hypnosis or hypnotherapy, and how that could play a role, how it could be a tool in helping address these different aspects of addiction. There are many hypnotists, many practitioners who use hypnosis to change specific habits or behaviors. So the idea is to find the subconscious program or programs that are connecting a person to that habit. In the case of cigarettes, for example, it might be the person craves the taste of them or craves a certain feeling or sensation that they experience when they smoke. It could have to do with a social setting, so they might be smoking when they're in certain environments or around certain people. So with hypnosis you can both uncover and transform those types of programs. You could actually put suggestions into a person's mind to find a particular substance or habit unpleasant or undesirable, where it won't give them that positive sensation or positive emotion that they've been accustomed to receiving from that behavior. So hypnotists often are skilled at inputting those new programs, shifting that subconscious pattern for a particular habit or a particular addiction. And that's often the focus of things like smoking cessation hypnosis, where they make a person not desire cigarettes in order to break that habit. Now, that's valuable, it's very useful, and certainly it's quite effective for many people, but we also want to recognize that that particular addiction or habit has played a particular role in that person's life, and if you remove it, if that's now not present for them, if they're not able to go to that behavior to get a certain feeling or sensation, they might end up picking up some other addiction, some other unhealthy habit or behavior to fill in that space in their consciousness, to provide some form of excitement or relief, compensation for whatever undesirable or unpleasant thing that they've been experiencing. So with hypnosis, we can actually tap into those other aspects of a person's consciousness to kind of heal the roots or core of a particular concern or a particular constellation of issues that a person has. So you might connect with different parts of that person's self or personality. You could access the child parts or elements of that individual. You could access even their ancestral patterns or past life, other incarnational consciousness patterns or influences. So to see where the emotional patterns or issues got set up from, and to address those to help that person have more balance within their whole being, to be more centered in their identity, more content, more confident, more at peace and at ease with themselves, where they don't have so much insecurity or instability, where they're no longer going to be vulnerable not only to the addictions that they've had up until that point, but to developing any other addictions. So they become kind of more immune in a sense to falling into addictive patterns, because their sense of self, the balance in their life, has become much better. So they're more healthy and whole. If you think about it, someone who's healthy is not so vulnerable to catching an illness, whereas a person who's already out of balance, already disturbed or depleted in some manner, they are more easily susceptible to catching an illness. Well, you can make that analogy here with addictions. A person who's very psychologically healthy and whole and balanced, centered in themselves, content in their identity, in their life balance or life flow, where they have meaning and purpose in their life, that person is not going to be very vulnerable to getting caught up in an addiction. So with hypnosis, we can work on those core aspects of the person, healing traumas, healing insecurities, helping overcome fears, helping release pain from past relationships, past disappointments, and so on. So this is hypnosis applied more toward healing the self, toward addressing emotional imbalances or traumas. And by getting to that level, we don't necessarily even have to focus so much on a specific addiction. As the person heals, as they become more balanced in their psychology, in their consciousness, then their body chemistry starts to come more into balance. They become more content with a healthy lifestyle. They're less easily influenced by negative people or situations in their environment. So they could be around other people who are getting drunk, and that no longer appeals to them because they feel content and happy and joyful within themselves. They don't need to use a substance to get into a particular mood or something of that nature. So this is where I feel hypnosis can actually have the deepest or greatest benefit in terms of healing on a psychological and spiritual level, not just on the superficial, you could say, or surface behavioral level. Not that that isn't useful, but we want to connect to these deeper levels of our consciousness to really grow and evolve and become more secure within ourselves and more harmonized with a healthy life, with having passion and purpose and greater meaning, greater well-being for ourselves. Hypnotherapy is a very valuable tool for that. It helps the conscious mind, the part of our mind that tends to get caught up in everyday stresses. It helps that part relax and settle so we can start to uncover what lies on a deeper level, and we can bring in some wisdom, some compassion, some other resources that may be needed to help the disturbed or wounded parts of the psyche come back toward a state of health and harmony, so we can be more present, more whole in our energy, in our being here in the present time and space. I hope that this introduction to the topic of hypnosis and treating addictions is bringing some insight into this topic, perhaps inspiring some of you, either if you're working on addictions within yourself or you're a practitioner of some kind who's assisting other people, to consider this as an option, as a resource. It can be a complement to other types of therapy, so it's not necessarily the one thing to use for addictions. It's just one of multiple modalities, multiple therapeutic resources that we can use to address the multiple aspects of a person, the multiple layers that could be playing a role in an addictive pattern. For those that are interested in healing resources that I present and in general information about holistic health and wellness, I invite you to view my website, phinsights.com, phinsights.com. For now, I wish everyone a wonderful day. Namaste.